Today we had an awesome interview with Lauren, who's a nurse at Memorial West. You were there. You heard it.
Yeah, no, I was able to watch it.
Some of that conversation, and she belongs there at the church with us, and God's doing some amazing things at Memorial West, away from the medical field. How they're coming out at 11, at 6 every day, and they're praying. And
Awesome.
so I tried to get both of you on. That was my goal for today. So we just had a whole bunch of technology. Even at the end with her, it froze, and I couldn't switch over to you. And then I was trying to get onto you, and it took a little while there. But thank you. You're on. Thank you for joining us, Robert. I love you, man.
I love you too, man. I miss you, man. It's good to see you.
Yeah, I miss you and your wife. And I'm just glad that you're able to come on with us and talk to us. You're a doctor at Jackson, and
Yep.
you've come a long way. I remember when I was working at Dade Christian, and you would come into my room, and Fridays, we used to have Freestyle Fridays, and some of the kids used to come in, and we used to have hip hop beats on, and we used to freestyle.
Oh my gosh, man.
and Rob was there, and I remember, Robert, that you used to lead during lunchtime a Bible study for the men, for the guys at the school.
Yeah.
And I would be there with Mr. Adams, and
Yep.
and we used to be part of that. That was special. So
Yeah.
and here you are today, a doctor. Tell us a little bit of what you're a doctor, but a little bit about what you do, where you're at, and what's happening with you.
For sure. Just before anything, I want to apologize. I had to get my dog here because if not, she was going to start screaming an unholy noise in the background, and I didn't want to scare everyone on Instagram Live. So, my name's Rob Andino, for anyone who doesn't know me. I'm currently a resident at Jackson Memorial. I'm an internal medicine and pediatrics combined resident. So I'm going for dual board certification at the end of my residency. I'm in my third year. It's a 4-year program. Essentially, I've been a doctor for about 3.5 years now. 3 years. And so right now, before I do anything, I just want to thank Lauren. So if the healthcare workers are like the front line, our nurses and our respiratory therapists are like the front lines of the front lines. They're like the soldiers going in there and dealing with it firsthand. A doctor will see and walk into a patient's room as necessary, maybe 2-3 times for like the absolute necessary things. But nurses are going in there, giving medications, adjusting IV things, the respiratory techs, dealing with the breathing for the patients who are especially in the ICU. Yeah. That's the most intensive stuff. So I just want to thank her for that, and all our nurses and all our respiratory therapists. It's really like incredible work that they do.
Yeah, that's awesome. Thank you for that, man. That's good.
No, for sure, man. Okay, so I mean, what I can do is I can talk a little bit about like what this is, because people hear coronavirus, COVID-19. People, they hear about like how we had SARS several years ago. I can kind of talk a little bit about like what viruses are and like why. Because there's a lot of questions I'm sure people have about why we do the things, why 6 feet, why are we wearing masks, why, like what kind of goes into it, how do you get infected? And luckily, so because of my internal medicine training, we are actually the main doctors who deal with the coronavirus, with COVID-19. Wow. So because of that, we actually, when this was first starting back, when we were really paying attention to it, like at the beginnings of February, we have a WhatsApp group with all the residents, and we actually started to send, videos of, the next things, because like the newest things, the newest drugs, the newest protocols that they're coming up, because we've never had anything like this. We've never had anything that evolves while we're doing it, where we didn't have protocols in place, where we're having FDA approval as we're learning about the disease itself. So it's been a crazy, crazy time. But to kind of go into like a quick spiel. Viruses. So viruses are actually dumb. Like the whole treating of viruses, they're not even considered living things. What they are is they're little DNA or RNA. And by the way, Rigo, if I get sometimes I get like slipping into like the medical stuff, let me know, because and like please let me know, because I'll do that way too much. So please interrupt me.
I'm online here Googling everything you're saying, just try to stay up to par with you.
No worries. So viruses, what they are is they're little protein and fat encapsulated organisms that they try to replicate. And they're not even considered really living things. They're like in a borderline between. And there's actually only a couple ways that they can enter your body. So the main ones are the openings that we have inside of our body. We have the eyes, which are the mucous membranes of our eyes. We have the inside of our mouth. We have our nose. If you have open wounds, there are certain viruses that are transmitted like through sexual transmission that we know about. So the reason why we've been doing social distancing, the reason why we say to wash your hands. So I'll start with washing your hands. Most people, when they wash their hands, they're not really washing their hands. They're kind of just getting it wet and doing like this to clear it. That's the reason why we say to do 20 seconds, because it kind of forces you to wash your hands. And there are certain techniques like
sing the happy birthday song, y'all.
And sing it more than once, because or you can do Twinkle Twinkle Little Star twice,
there you go.
or you can set a timer. But the idea is that the viruses, because they're surrounded by this fat, soap is a detergent. It actually breaks down fat. So the antibacterial soaps, any soap really, is going to help destroy that. And so what it gets in contact to, and the same thing with the ethanol in hand sanitizer, the alcohol-based ones, they'll help kill the viruses. If it touches the virus, it essentially kills it. But it has to touch all of the virus. Like you've heard, I'm sure, with Listerine, you know how it says like 99.9%. Right. Like, and you wonder, like, what's that 0.1%? Is it like resistant? Well, no. The reason why they say that is because it depends on you being able to reach all of the inside of your mouth. That's the same thing with hand sanitizers. The reason why it says 99.9% is it kills everything it touches, but you need to get it all over. And it's the same thing with washing your hands. So like these are things that like we kind of take for granted. It's like, oh, 99.9%. It's extremely effective. You should wash your hands. How often? Honestly, you can't really do it too much. Anytime you touch something, like I have my laptop here. Anytime you touch something and say I have a bacteria or a virus on it, what we call this is a fomite. So what a fomite is anything that can be touched and you can leave either a bacteria or a virus on it. For coronavirus, for COVID-19, we know that we've done some testing. We know it can last about 3 to 4 hours on certain materials. So that's the reason why we try to wash our hands as much as possible. Technically, you can have coronavirus on your hands, but if you don't touch your eyes and your mouth, and if you wash your hands reasonably, you're going to be fine. So coronavirus, COVID-19, it's the real name for it is SARS-CoV-2. You remember SARS way back when? That's my other dog who's making noise. If you remember SARS way back when, it's the same family of viruses. It's called coronavirus because the actual virus itself looks like a crown. Yeah. So it's extremely, extremely infective. It's a very infectious virus. In terms of the flu, I know a lot of people have tried to like compare it to the flu. I'm going to go ahead. I'm telling you, this is not a political thing. I'm not with the media. I am not trying to scare or do anything to try to make people think that I'm trying to keep you in your homes or keep you out of your jobs. Right. It is, at the very minimum, from what we've seen, 5 times more infectious than the flu. Because of that, like, I'll give you an example. The flu kills tens of thousands to hundreds of thousands of people every year. Okay, I think last year was 68,000 people, if I'm not mistaken. And that goes through all the complications that we kind of just throw at the flu. The thing with the actual flu itself is first off, when we calculate those numbers, we're doing it over a 12-year period, 12-month period, right? This has been about 2 months, let's say, barely 2 months. I've never been in a 2-month period where I see my ICUs get filled with the flu. I've never been in a 2-month period where like the hospital, half of it has to be emptied out to make room for the flu. So this is serious. It's a serious thing. That being said, I agree with Lauren that there is a light eventually at the end of the tunnel. Good. But it's dependent on us carrying that light out. That's good. That's good. Yeah. So the social distancing, I can talk on a little bit too about why 6 feet.
Before you talk about that, let me ask you a question. So you're at Jackson. Yeah. Which Jackson are you at?
So I'm at Jackson, Maine. The Jackson Memorial. It's the main hospital that's using for testing. It's the major county hospital. It's actually the biggest hospital in terms of beds in all of the Southeast.
So definitely in Florida. So are you seeing an influx? You've seen an influx of people with coronavirus with entering the hospital, taking up beds. Where are you at with that?
For sure. So, I can give you the numbers. So I'm going to be kind of vague with it because I'm not sure exactly how much about the numbers. I can tell you we've seen our ED. Usually we have 3 EDs. One of the EDs, which all run as if it were the equivalent of like a normal hospital's ED. We have 3 separate ones. One of them is completely devoted to coronavirus, especially for people who are higher risk. The other two are also getting overflow of coronavirus.
Wow.
Currently, in terms of admitted patients, we have more than 160 patients dedicated that we know have tested positive for coronavirus in our hospital.
Okay.
That's a number that not many people know about. So the reason why that's important is this virus, when you get intubated, and not everyone gets intubated, and that's a good thing. When you get intubated, it's very serious. The elderly, people who have comorbidities, which is like other diseases, people who really decline hard and have to get intubated, I will tell you, it takes weeks to recover. It takes weeks. And the reason why we've been doing the social distancing, the entire reason, is because if I have a vent being occupied by an elderly person for weeks, we could eventually fill up. So if you can imagine like a funnel and you're pouring water and eventually you start to overflow. That was our big fear. That was our big fear at the beginning. I'm sure when you remember at the beginning, they're like, oh, 2 million people can die if we don't do anything. And the reason being was this. We knew that it has an attack rate of 30 to 40%. There are, and I apologize if it gets kind of in the weeds of like what the numbers are. It's a thing called an R naught. It's an R, basically. Tells you how many people you expect one infectious person to infect. When this started, we expected for every person, they could possibly infect 3 people. And that's an extremely high number because if I go from 1 to 3 and take those 3 and they infect 3, that's how we got that humongous curve. You've heard of flattening the curve?
Yeah.
It started to go up and up and up and up. And our fear was that without it balancing out, we would hospitalize too many patients for our hospitals to take care of. The hospitalization rate for this disease was around 20 to 30% from what we saw in China, in Italy. Certain other places have been able to avoid it with good testing, but like in the worst places, we saw it there. When you occupy, about 20 to 30% of them, 2 to 4% end up qualifying as severe. Now, when you qualify as severe, 2 to 4%, when you're talking about millions of people, is a lot of people. When you qualify as severe, if you got intubated in the countries where we saw like Italy and China, half of them would not make it. Now, that's the dark news. There's the good news. So here's the good news, okay? Because I don't want to scare everyone, because that's why everyone. There is good news. So that's why I want to give it all context. These numbers were from places where they were slow to react to it. Fortunately, some places here in the U.S., I would say a lot of the U.S. was slow initially to react to it. But our country is one of the most intelligent and has a lot of resources in terms of mobilizing things. So we have companies creating ventilators. We have hospitals that are very creatively moving around and making space for beds. If we can get you supported on like a ventilator system, or we can support you and get you out of the hospital, eventually we were able to see that we can keep those numbers, that whole flattening the curve, down, and we could save hundreds of thousands to millions of lives. The current death prediction, because I know that's going to come up as a question. Those numbers alternate. That
all
is
right,
all
you froze
dependent.
it.
Oh, sorry. I froze?
Yeah, you're on.
Okay, no worries. And I apologize, Rigo. I'm talking way too much. I'm flooding you with way too much
No,
information.
that's good. Go ahead, and then when you're done with the statement, maybe we could we'll let people ask some questions.
For sure. So 68,000 is originally, when it started off, without any social distancing, we were able to calculate that we'd lose around 2 million people. By flattening out, we've done this for now weeks. I don't even know how long we've been doing this social distancing.
Like a month now, I guess.
Oh my gosh, it's been crazy. The reason for that is because we know that if you can go 2 weeks, usually those who would be less severe can get past their infectious portion from what we've seen in the data so far. So the idea was that if those people can get infected, but they develop immunity to it, eventually they can be released back into the workforce. That was the hope. We're kind of like, we're checking, we're getting new information and learning like, okay, is this the case? We're doing antibody tests now, which is good. It's the reason why it's so scary. As a doctor, usually we're used to like the flu, where I know what the numbers are. I have a vaccine. I know how to test. The testing has been very weird. The treatments, as you know, I'm sure you've seen, have been all over the place.
Right.
But we are learning. I do believe that we are a very creative country. I believe that we're a very innovative country. And I will say that, like, it's incredible to see how people get through the worst part.
Yeah.
Because this, I almost cried when I saw that memorial. Like, I know I couldn't hear the music, but
I'll send it to you. Remind me. Yeah,
oh
awesome.
my God, it's beautiful. So Jackson unfortunately, they don't do, what we do have in terms of support is a small group of residents have a WhatsApp group where we actually support each other.
Nice.
We do Zoom meetings and we talk to each other. We give each other encouragement and support. There are several residents who have gotten infected with COVID. I got tested for COVID. I'm negative, thank God. But the fear is not for us. I'm 28 years old. I'm likely going to be okay. The fear is for my parents. Fear is for my grandparents, not being able to see our family members. So a lot of doctors and a lot of nurses and a lot of respiratory therapists have been staying away from their family members at all costs. Which that's the isolation, that depressing being separated from your loved ones. It really can be crushing, and I see it a lot. Mental health amongst my colleagues, especially the ones who don't have anything to really believe in, unfortunately, it's destroying them. It's keeping them at home. They don't have anything to do. We're so used to working through and having things to do. Wow. A lot of the residents are being kept at home right now. And then the idea here is, as we get infected, we'll pull people out, take new residents, put them back in. And so we're kind of interchanging like that. I'm currently on a transplant service because one of the residents got sick.
Wow.
Yeah, so I got pulled to cover for it.
Wow.
But I do believe that our country is innovative, that we can get through this.
Absolutely. Robert, thank you so much. Again, I know there's people that are tuning in. This is Dr. Robert Andino, and what a blessing it is to say that. And he's working hard, and we thank you. You're one of the you're one of the heroes out there, man, that are working hard. Like Lauren, who we just had a conversation. We had a conversation with, and I know there's some people asking questions. You just showed us that mask. This is a picture of you right there, and this is you right there at work, where you have your. Go ahead and explain some of your equipment. I know some people are asking about, like, what is something that you guys need help in, or how can we assist, or what are some ways that we can help our friends or family that are in the medical field. And I know that Lauren was saying that the equipment was scarce and stuff like that, but share a little bit about this.
So here's the thing. The way that we block it, so we know there are 3 types of isolation, and I'll explain to you why we do them. And I'll explain what I'm wearing in that photo as well. So as you see, I have my face shield, which is reusable. I actually had this 3D printed from one of the residents, which is really cool. It's really awesome. We have N95 masks, and we have surgical masks. So there are 3 types of isolation. We have things called contact isolation, where if I touch you, I can get infected from whatever you have. The next one is droplet, which is if you sneeze at me, or you cough or anything like that, and it gets on me, or I put it to my eyes, I can get what you have. And the third one is called airborne. And the idea there that is when I cough, like something like tuberculosis, is something we consider airborne. And those are usually very serious. And we're treating COVID like it's airborne. Because if it stays in the air, even if you're not coughing, even if you're not sneezing or anything like that, the actual virus or the bacteria itself can float in the air, and you can breathe that in, and you can get infected through that. So the different type of masks. The reason why we tell everyone to use cloth masks, it is not really to protect you from breathing it in. And I want to kind of address that. The reason why we're doing it is to protect you, the people around you, from breathing out what you're breathing. So the reason being is this. When you put on a surgical mask, okay? So this is a surgical mask. We'll pretend like it's a surgical mask instead of a cloth mask, okay? I'm just putting it on really quickly. Oop. So surgical masks,
okay,
right here. The main reason why they exist is if I'm performing a surgery and I'm sick, I don't want to be able to cough into the sterilized area of the surgery and infect it with whatever I can have. It's not to protect me, it's to protect you. So if I had like a flame right here and I tried to blow it out, it would not go out. I
Mm.
could barely, I guess if I could pull the strings, then I could show you that when I blow, nothing actually comes out. But because it's not skin tight, because technically things can go around into it, it is not foolproof for protecting you from airborne things. That's where we have this. And in that photo that you have there, I have a duck bill. So you might notice a difference between me and that photo is I have a full beard in that photo.
Yeah.
The reason why I have a full beard in that photo is because I was trying to avoid having to shave my beard. I have a goatee now. And the reason being is because it's now CDC compliant for fitting this. Okay?
Ah.
So to give me 2 seconds, I'll explain to you what an N95 is. Okay. Okay. So the way an N95 is supposed to work is you get a good seal. Okay? You pinch the top here. It has 2 strings because it's supposed to keep it taut. It makes me look even fatter than I actually am because it's really pushing up against my cheeks. I had to shave my goatee so that it would actually fit under the mask so that the seal can stay good.
Mm.
So that's why I couldn't keep a mask on. I couldn't keep the beard on. I had to end up shaving because I was going to be seeing coronavirus patients while I
Okay.
was in transplant. The actual purpose of this is to full on protect you from breathing things in. This is being reserved for our healthcare workers. This is the reason why I get a little bit mad when I see people wearing N95s in the grocery store.
Mm.
Because if you're in the grocery store, now 6 feet, the reason why it's 6 feet is because they've done studies that show that when you cough, when you sneeze, when you spit, or whatever you do, we know that the particulate using gravity can only go, unless you're Michael Phelps, it's only going to go about 6 feet in length. In some studies are showing possibly 10 feet, but that hasn't been verified yet. So the idea there is if you stay within 6 feet, even if someone's coughing really, really hard, none of that virus is going to get to you. So if none of that virus gets to you, you're fine. With this, you're probably going to be fine because the virus isn't going to be hanging out in the air to come in through
Right.
the sides of your mask. And if you wash your hands, even if you got coughed on directly onto your hands, and you don't touch your eyes, your mouth, or anything like that, you're perfectly fine. The face shield is to protect your eyes in case you were like doing something like an intubation or something like that. We go overboard because we want our healthcare professionals to be safe because we're dealing with coronavirus every single day.
Mm.
And there are certain procedures that are very, very dangerous, like intubating a patient, putting a tube in, where we know that viral load is extremely high. So a cloth mask, is that enough? Yeah, 100%. If you're out in public and you're wearing a mask like this, when you cough, you're less likely to spray out
Okay.
that virus, that bacteria out into like the world. If we're just treating each other cleaner, if we try to just do the social distancing for long enough, the pockets where the virus is living can die off. The virus
Hmm.
needs us. The virus needs us to survive. It's like a parasite. Well, that's actually a virus. So the idea there is 14 days, if most of it dies off, or unfortunately the people who have it who can't survive, kind of unfortunately the part of the quarantine is they actually end up taking the virus with them. Then eventually the idea is that we can control this, have the curve flatten, our hospitals can control this, we can open up again and live a normal 2020 eventually.
So what do you
Um,
see? What do you see in the sense of like the time frame of this being in the medical field and what they're saying? And there's so many. I mean, so many people are saying so many different things. But what is your opinion, your thought on that? Like when not. I don't know if you want to say when things will get back to normal, if they ever will be normal again. But you know what I mean, in the sense of back to work and back out in the streets and stuff like that. What would you say? What does that look like?
so I'm going to be responsible about this because I have some thoughts about this specifically. We need to accept something. Everything that we're seeing now, it's kind of like when you're looking in like stars in the sky. Everything, when you look at a star in the sky, what you're actually seeing is the light that's coming from that far away. It's showing you light years away, right? So you're actually looking back in time every time you look at a star, right? What we're seeing now in terms of our rates are the effects 14 days ago. So the effects that we did 14 days ago, now we're starting to see it. That's why the curve starts to flatten now. Florida's cases are starting, it's a component of how much we're testing too. But Florida's cases are starting to flatten a little bit because we've been social distancing for so long.
But then you hear
That
other
being,
news outlets and they're saying that the peak is not till like a week or two. Or, yeah.
So the national peak, according to the IMHE, which is the model that, based off of Washington that most people are using, I will use a grain of salt here. The IMHE is the most accurate one that we've had so far. But obviously the models, it's like trying to predict the future. It's the best guess that we have. It would have been that the peak cases for the entire country was about, in terms of deaths, hopefully would have been about 2 days ago. So we had about 2,100 deaths, that would be the peak of it. Now, the problem is that peaks for us means a plateau. So we're going to see a couple thousand people dying for a couple days. And then we hope that it starts to go down. The amount of people dying doesn't increase, it starts to decrease. But Florida, there are a couple things that protect Florida. But Florida's peak is expected between April 21st and May 3rd. That's why in my hospital, what we've actually started doing is preparing. We emptied out the hospital. We completely emptied it out. Now about 50 to 60% of the hospital is only like we have about 50 to 60% of it full, but it's mostly COVID patients that we're dealing with. So, or patients who absolutely can't avoid being in the hospital. So the actual peak from Florida, it's going to be in about 2 weeks, maybe a week and a half, when we can open up again. So we need to understand, we have to accept this. And I'm not trying to predict the future, but it's something that's going to happen. When we open up again, we're going to see a bump in cases again. It's unavoidable.
Well, that shuts down again.
So that's the thing. So it all depends on, it's a clever balance. I'm a doctor. I'm biased by trying to save as many lives as possible from this thing. And I understand my bias, but I understand also that a lot of people are going to die if we don't open up our economy again. There are people losing jobs, people who ended up like losing their jobs last week.
It's horrible.
So it has to be a balance, because if we do this for so long that people are going to die from, starvation, or because, they can't afford to pay for their homes anymore, then that's the balance we have to do. Currently, the national guidelines last up until April 30th. I probably think that that's going to be extended a couple more weeks. If that is extended for a couple more weeks, I think that the way that our leadership is going, they're trying their best to open up the country. But for that to work in a responsible way, we have to do testing. We have to do a lot more testing, because I'll give you an example. In January, I was in the PDR and I felt very, very sick for about 3 to 4 days. Now, that was in January before we had any reported cases, but it is possible that we have people who have been exposed. They develop the immunity and they don't know that they're immune. So there could be people sitting at home scared of this virus who might be immune so far. The only way that we could responsibly send them back into the population is if we do more testing to say, hey, this group of people, you're likely safe. There's some studies showing that possibly there could be some reinfection, but nothing crazy so far. Nothing's come out definitively for that. So if we could do more testing, I would be surprised if this administration keeps it locked down past the end of May. I would be surprised also if the administration doesn't extend the guidelines maybe 1 or 2 more weeks after April. I'm going to warn, and I'll warn everyone about this. If and when we do open it, we have to emotionally prepare. We're going to bump again. So, and you're going to see a rise in cases again, but hopefully the bump won't be so high that it'll overwhelm our hospitals. So some people predict that we'll either have to keep opening and closing until we eventually have a vaccine. Some people, here's the thing though. All this changes.
Should we get into the vaccine conversation?
Yeah, no. The vaccine, listen, the vaccine, we have the most innovative, we are the greatest country in terms of innovating new drugs. Do I believe that we could come up with a treatment for this in the next 3 months and hopefully things would turn for the best? God, I hope so. We should pray for that, because I want to protect our elderly. A vaccine is the only thing we know of that has worked in the past. So that's why we're aiming at a vaccine. If we could get a treatment that definitively worked and cured this, or at least lowered the mortality or got people out of the hospital quick enough, then that can change things. If we could learn certain techniques, or we could test certain people to send them out in like when we know they're immune, that could change things. It's hard to predict past the next couple months.
Of course.
But I do think there is a portion that, you know, doctors are trying to scare people because people sometimes don't listen. And so there is a portion of that, but this is not the flu. This is the worst thing I've seen in my medical career. No one that I've ever worked with, that I work with in my hospital, that includes all of my people who are in their 60s, 70s, they've never dealt with anything like that. This is the worst thing we've dealt with since the Spanish flu, which killed like 2% of the world's population back in like the 1910s. It's serious, but we're better prepared. And I think we're going to rise up to the challenge eventually.
Thank you, Rob. Again, thank you. I'm talking to Dr. Robert Andino from Jackson, Maine. We're just talking vaccines. We're talking COVID, health. Let's give opportunity for some questions. I see that on the feed, people are asking questions, but let's go into this question feature here that Instagram has. So here we have a question that says, who are the ones recovering, and why are some carriers not showing any signs of illness?
Okay, so here's the thing. The way that we're measuring recovery, and the reason why certain people respond differently, the honest answer is we don't know why certain people are either getting more infected or showing more severe symptoms. I'll give you an example. Just yesterday, I don't know if you've heard about this side effect of the coronavirus, where of COVID-19, where you lose your sense of taste and your sense of smell. Have you heard of that kind of thing, where like people who like one of the signs they get concerned about is, oh no, I can't smell, I can't taste. So what they found recently, but this is all kind of quick data, is those people might actually be recovering much quicker. That, you know, there are certain people, either because there was a big scare at one point about what medications you might be taking, what blood type you might be taking. In all honesty, the most truthful answer I can give you is we don't know yet. When HIV broke out, and everyone was freaking out about, you know, can you be in the same room with someone with HIV? Can you drink the same water as someone with HIV? Later on, we educated ourselves. We learned so much about that virus that we knew that the only real way you can get that is, you know, through blood or, you know, sexual transmission. So like we're learning about this. We don't know exactly what predisposes you, but we are adding more information every single day. There's never been so much research put out. I'm going to be working on research papers for COVID-19. Like it's insane. It's insane how much research is being pumped out right now, because honestly, we're locked in our homes and we have nothing better to do than to just do as much research as possible.
A question was asked in our last session with Lauren, and they're asking again, you know, how about for those who are pregnant women? What can we say to them so that they could be cautious? What should they be doing? How do we keep them safe?
For sure. So I was just in the neonatal ICU. I was in the NICU very recently. I attended multiple deliveries, and we've had deliveries with coronavirus positive patients with babies who were exposed as well. I'm going to give some good news here. We have no documented as of yet any cases of perinatal, which is, you know, virus that gets passed on from mother to baby. So if you're worried about your baby getting coronavirus because maybe you develop it and you're a pregnant mother, that is unlikely to happen based off the data that we have right now. Now, are we going to test that baby, separate that baby, make sure everything's clean? 100%, because we're still learning about the virus, and no one wants to be the first one. For pregnant women, the most important thing is be honest with your OB-GYN. If you're having symptoms, be honest, because I was recently on a case where there was a pregnant mom who was scared that she was going to get worse care if she admitted that she was having fevers and chills and having coughing. She didn't tell anyone. On the third day, they measured her. She had a fever of 39. Her baby had been in the NICU for several days, and no one had been doing any testing. Wow. And so a bunch of doctors had been talking to mom in the room without patient protective equipment. A lot of people get exposed. The biggest thing is be honest. If you have symptoms, they're going to get tested. It's not going to do anything for your baby in terms of treatment. In terms of hydroxychloroquine, azithromycin, those drugs, about treatment for them, we know that I'll go into that a little bit later if there's a question about those treatments. The biggest thing for pregnant moms, isolate yourself. Lock yourself away. You want to make sure that you don't get exposed. Wash your hands. Do the same thing that you would do if you were 65 years old, or if you were someone who had asthma. Is there any worse for pregnant mothers? No. But pregnancy by itself and giving birth is so stressful. The last thing you need on top of that is coronavirus thrown on top.
Right. Right.
Yeah.
Thank you for that, man. So good.
For sure.
All right. There's a lot of questions. Let me see. I'm going into the question little thing that Instagram added here. So I'm just going, what about lifting up your immune system with elderberry and ginger, turmeric to your daily intake?
So a couple things here. I'm going to be as honest as possible about data. Okay. And so in terms of the data that we've collected for ginger, turmeric, and elderberry, I can tell you that there is data on elderberry when it relates to the flu and how it shortens the duration of your symptoms, how it can cut it in half. Sometimes it actually makes your symptoms much better. I took elderberry when I was in the pediatric ER. I've been in the pediatric ER on 3 separate months. And the first 2 months, miserable. I had kids coughing in my mouth all the time. I would tell them, open your mouth, say, ah. They would cough into my mouth. I would get the flu or I would get something. This last month, I decided to prophylactically take elderberry for the flu. And I was great. Honestly, my symptoms were great. You can ask my wife. She ended up getting what I got, and she was miserable. Do I believe that can they do any harm? Don't abuse them. If you think that it's going to help, the two that I can tell you that there's been research on for other viruses, not COVID, we haven't had any good data for it, is elderberry. There's some data that shows for the flu. For the common cold, zinc has possibly been able to show some efficacy for shortening the duration of it. The main problem that we have is we don't know enough about this to say whether or not you're getting better just because, the virus is going away and your body's fighting it off on its own, or if there's actual data that shows that, zinc and elderberry are helping like a good amount. I believe that there's no harm if you want to take elderberry. And the two I would say is possibly elderberry and zinc have been shown to possibly work in other viruses. If you want to take that, for sure, there are certain protocols for treating coronavirus. There's being used in New York kind of experimentally involving zinc. Don't overdose on these things. You can get toxicity. Okay, don't take fish cleaner. You can die. Do everything. If you have a question, consult your doctor. Don't go off of what you Google on the internet, because a lot of people, because they don't understand the amount of doses, or they might be taking another medication that interacts with something that they're taking. There are people who take blood thinners that they don't realize if you mess with things. If you drink grapefruit juice, something as simple as grapefruit juice can mess you up really, really bad. Yeah. So, if you're going to start a vitamin, talk to your doctor. If you want to take elderberry, no doctor is ever going to tell you, no, that's bad for you. Elderberry and zinc, those are the two that I would recommend. Vitamin C has not shown strong data about helping with boosting your immune system. The big problem with vitamin C is because it's a water-soluble vitamin, you pee it out. So you can get, toxicity if you take too much, but zinc and elderberries, if you want to take it, I'm all for it.
All right. Quickly, how about how often should you wear your mask? Someone was asking that.
So how often should you wear your mask? It's all going to depend about the context of what you're talking about. Right now, we're having everyone wear masks out in public. The reason is not to protect you. We're not thinking about you as the person. We're thinking about society as a whole. It's to protect the person next to you. I'm working in the transplant. So you should wear your mask every single time you step out of your house for right now, until we can control and flatten this curve some more. We'll be able to see it in 2 weeks, the results of what we do today. I'm working in the transplant unit right now. When I hear people who tell me I'm 28 years old or I'm 25 years old, who cares if I get coronavirus? It's not a big deal. Well, I don't care about you. I'm not saying I don't care about you as a person. I'm talking about I don't care about the fact that you're not going to get sick. But my grandfather just had a heart procedure. If he gets it because you're coughing and sneezing and you grab the same doorknob as him, you just killed my grandfather. I'm working in the transplant area. They don't have an immune system. There are people with cancer. They don't have an immune system. They need your help. And so the masks aren't just to protect you. Yes, they're going to protect you if someone sneezes directly on you, but it's to protect your love thy neighbor. You have to take care of the person. We are all our brother's keeper, and we can't just think about, I'm going to be fine. I'm a young person. Yeah. No, it's a very serious thing.
All right. Another question is, are kids really less likely to contract the virus than otherwise healthy adults?
So there's no data about how effective it is, because we don't know if someone's an asymptomatic carrier or not. That being said, in terms of kids being able to contract the virus, we do know that their mortality is much, 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 much lower. When a child dies, it is a tragedy. It's the worst thing. I've had to be part of a couple recent conversations, not with coronavirus, and I can tell you it destroys everyone's world. They are less likely to show symptoms. They are still getting infected. It depends on what you mean on a kid. If you mean someone who's 18 to 35, we were having about a 40% infectious rate and hospitalization rate in our country, as compared to other countries where the elderly people were showing up. If you're talking about less than 18, we only have a smattering of deaths. So your children are less likely to die, but they're also less likely to engage in hand hygiene. They're going to be producing boogers and snot. So I wouldn't let, your little kid, if they've been exposed, they go hug up on abuelita or abuelo, and they can get them very, very sick.
Right.
So they're still reservoirs. We don't know enough because we're not testing every child to see if they're getting infected and they're just not showing symptoms.
Cool. Yeah, I didn't know you could do this. I mean, I'm learning the features, and this is something new to all of us. So I'm figuring out like new things that you could do. So like, here's another question. Do you think we could build immunity to this virus so that we don't get it again? Is plasma testing really is really working? Is it really working?
So we are hoping. So do I think so? Can we get immunity for this virus? I know that we build antibodies to this virus. I know that the infection rates, the reinfection rates for people who have already been exposed are much, much lower than the people who have never been exposed. Those who do get reinfected have much lighter symptoms. It's kind of like, you've heard of, it's not a great analogy, but if the chicken pox, or, you heard like you get it once when you're a kid and you can't get it again. We don't have enough data to say that's the case here, that there is not a chance for you to get it again. Our hope is that our bodies will build immunity. Our hopes are that we can build a vaccine, like that we could develop a vaccine that creates the antibodies that tricks our bodies into thinking that we've already had COVID. Yeah. I have hope that I'm a hopeful person by general, but I have hope that we'll be able to build immunity. There's something called herd immunity. If 80 to 90% of people have been vaccinated or have had the virus, those who have not get vaccinated or have not had the virus, they can still get protected because of the people around them not being able to get infected. So they project that we won't reach herd immunity to around 2022. I don't think we're going to be doing what we're doing now, this strict social distancing, till 2022. I think anyone who tells you that is they're just trying to get you scared.
Yeah, I saw that too.
But that's assuming that we don't continue with the social distancing, or we don't do something with a vaccine, or we don't develop some sort of treatment that's very effective. That's trying to predict the future. That's like telling me who's the president in 2028. Well, I don't even know if that person is even thinking about being president right now. Like it's silly to think that far ahead. We're really taking it 1 week at a time.
Thank you.
Yeah.
Thank you. I appreciate it. So I mean, we could really be here we could be on for hours, and I mean, we could
whatever you want.
But I want to respect your time as well as things I got to do. But I just
for sure,
we appreciate you, Rob. I mean, just taking your time out. I know you're busy, and I mean, you're there at the hospital, and we thank you. Again, I'm talking to Dr. Rob Andino. It's what an honor for me. I was able to stand before you and your wife and officiate your marriage and see you as a youngin at Dade Christian, to grow up to you were always knowledgeable, and you were always your mind was always working. I always remember that. Since high school, right? We knew you were going to do great things since high school. I mean, were you the valedictorian?
Yes, I was co-valedictorian.
Yeah, I remember. Yeah, I remember you gave the speech. I remember. I think you showed up. Hey, read it or something like that before we read it. We read it through. I mean, it's such an honor, to just know you and Annabelle and just be able to be alongside you. You're someone that I appreciate. When my son has a droopy nose, I call you.
I love you, man.
If there's something wrong with his mouth or something wrong with, I call you. Hey, Jackson, or has something going on, and you help me out and you tell me what to do, and I appreciate it. You've come a long way, and I can't wait to see where God's gonna take you, man. What can we pray for in your life, man? What's something that I could just pray over you and just come alongside you?
So I mean, I think the biggest thing, we want to pray that our country takes. I remember 9/11 when I was young. I think the biggest thing that we can pray for overall, we're going to get past this. We're built for this. We're the best country in the world when it comes to addressing these things. Like, we're going to get past this. But I think the biggest thing for me personally, man, I live I'm a doctor in the United States of America. I living such a blessed life. And honestly, this is what I love doing. Like, the idea of being able to see people who like this is fascinating to me. There's new information, we're learning about a new virus. Like intellectually, it's fascinating. And I mean, I love what I do. But like, for our country to heal, like in general, for us to grow, because I remember after 9/11, when it was that terrible tragedy, we grew together and we came together as a country and we were able to move forward. I want that to be, what happens in our country again. 9/11 killed around 3,000 something people. In New York, more people have died than that right now. We are living, I was thinking about this, I was talking to a couple friends of mine. We're living a chapter in history right now.
Yeah, no doubt.
My grandchildren are going to read about 2020 and the outbreak of coronavirus, because it's taking up a good portion of this time, and it's going to change things forever.
Yeah,
but if we can change for the better, I mean, I'm gonna be honest. Seeing people pray in a hospital, I mean, oh my God, that's so awesome. Like, that's like
amazing.
Unfortunately, I work in a state hospital, so I don't know if they'd be able to swing that, but it's a beautiful thing.
But nothing's impossible for the Lord, man. I can see it
my God, no, for sure. No, don't get me wrong. Don't get me wrong. Almost every nurse that I work with, I mean, you best believe that
there's prayer going on. There's prayer going on.
100%. On Easter, on Sundays, try to stop them from blasting worship music on their phone. Try them. Oh, man, no, it's beautiful. It's an awesome thing. So,
yeah.
I mean, I guess pray for healing for our country, for unity, for us to grow stronger. And I guess I will say this. A lot of the healthcare workers that are dealing with this right now, they can't go and see their families. I'm going to be in the ICU 2 of the next 4 months. There's a legitimate fear about me, getting members of my family sick over the next couple months. And the idea of isolating ourselves, what Lauren said about sending a text, calling in, checking in on someone who's dealing with it, because we're not used to seeing this amount of death. Like, usually a bad day, you would lose 1 to 2 people, but over in New York, they're losing people. They'll have 15 codes, which is like, CPR and all that stuff in, just a couple hours. It's insane. We're living through something that's never been done before. So, just check in. I know you text me, I love you, and all those things, and you check in on me, and those things legitimately mean a lot. I've been FaceTiming friends more than I've ever done in my entire life. I've never been a FaceTimer. But no, those would be the biggest things that help and push us forward. We're not superheroes. We're just doing what we love, and this is the time to do it. The same way that teachers do what they do, like soldiers do what they do. Attorneys do what they do. My wife wants a shout out. Pastors, of course. No, pastors.
I mean, I saw your wife asking for a shout out, so I was just gonna.
No, you heard that? No, for sure. No, we're doing our job. We love what we do. And this is a time that we're just happy to step up to that calling.
You guys are doing a great job, man, and just seeing you guys in the forefront, man. Again, here's the picture of Rob in action, Dr. Robert in action, right there.
Can you find my ID? Oh, can you get my grab my
show
watch?
the ID. Yeah.
Rigo, I'm gonna show them a photo of when you knew me. Yeah, it's disinfected. Everything's disinfected. Rigo,
do you have a picture of me though? Of when?
No, you probably look even younger.
Thank God.
You have a what? Oh yeah, I should probably hide the actual numbers themselves. This is what I looked like when you first met me, man.
There he is,
man. So time has passed, to say the least.
Wow. Miss Fuentes is on, and she said her 2000 and was it 18? No, it couldn't be 18. 2000 and something Rainbow champ. She didn't give a year. My Rainbow champion. That's right.
Yeah, Rainbow was fun. I love trivia. I just like researching. It's a lot of curiosity. So
yeah, you're awesome, man. I appreciate you, man. And I appreciate everything that you're doing. Continue to do it. Lauren as well. She wasn't there in our first session. We thank her so much. You guys gave us so much information today and so much that we could take home and just reach out to you. Where can someone maybe reach out? I know you have this handle right here. If someone maybe wants to DM you or something like that, feel free to do that.
Yeah, 100%. Reach out to me. And honestly speaking, like, Rigo, you can give them my number, man. Like, I have no problem. If someone has a question, I have no problem. They can reach out to you, if it's something concerned about a family member, if they know someone at Jackson. I will say this. If you know someone at Jackson who's going through something, I might not personally have the power to, but I can tell you I've been there a long time. I have a lot of people that I've, grown up with, learned with. I have a lot of people who I respect highly. And I'll do whatever I can to try to help within that system.
Awesome, man. Thank you, brother. I want to pray for you and pray with you. Is that okay? Let's do that.
Of course, man. Of course.
Man, let's go. Lord, we thank you, Lord, for just this time tonight, Lord. Thank you for Rob, Lord. Thank you for his life. Thank you for his knowledge. Thank you for his heart and his passion for what he loves, Lord, in the medical field, and you calling him there, Lord God, with all that he knows, but yet also in his heart, a God-fearing man, Lord, someone that knows the Lord as well. And we just thank you for him, Lord, and his family. We thank you for his wife, Lord. We pray that you will continue to put a hedge of protection around him and Annabelle, Lord. Continue to give them the wisdom that they need, Lord God, as Robert continues to go into the hospital, that you would protect him, that you would give him the wisdom that he needs, Lord God, and that you would continue to give him strength, Lord God. Encourage him and all the co-workers, everyone in the hospitals, Lord God, all the first responders, so many people that just are in need of prayer because just of the weight that this is upon them, Lord. So I thank you again for my friend, for my brother, and we just love you, Lord, for people like Robert that you placed here in our lives to give us this information, but not just to give information, but to do something about it. And we just thank you for him, Lord God. Continue to strengthen him, let him be a voice and just a beacon, Lord, of light and a hope to so many as he's there, as people maybe in the hospitals feel hopeless, and to his friends and coworkers that are dealing with mental illness and all kinds of stuff, that he would help them and give encouragement. So, Lord, thank you. Wow. We love you. We honor you, Lord. In Jesus' name. Amen.
Amen.
Well, some people are still on the streets racing and stuff like that. So.
Right? That was crazy. They're racing to the hospital? I hope not.
Yeah, man. Well, we'll have you on again, man, because we definitely want to hear what's going on, and we want more information that you could give us. And if you feel like if there's something that you need to let us know, just let me know, and I'll we'll put you on. We thank everyone that's joining us next on this week. We have 2 Nest Talks, so we had 2 guests today, in Lauren and in you, Dr. Robert, and we also have one on Friday. I'm so looking forward to Fridays as well. Just thank you for being on, and everyone else that's on with us. On Friday, we will be having Pastor Mark from Love Unlimited Church. He's going to be joining us. We're going to have some amazing conversations at 8 p.m. on Friday. Don't miss it. I appreciate you, Rob, for being on Nest Talks. Have a good night. Give your wife a hug.
For sure.
And we'll talk and see each other on the phone soon.
For sure, man. Be safe with you and your family. I've been thinking about your dad this entire time, and you know this, and I've been asking about it. I hope your entire family is good. I miss Rigo Sr. I love you guys. Be safe, okay?
Thank you, man. Love you, brother.
Dale, man.
All right, everyone. Bye. Take care. God bless you guys.
Bye.